Welcome to Savita University Lecture Cast in Anatomy. We are going to learn about the Norma Frontalis. Norma Frontalis is the anterior view of the skull. The bones which are seen in the Norma Frontalis are the frontal bone, the zygomatic bone, the nasal bone, the maxillas, and the mandible. The sutures which can be seen in the Norma Frontalis are the frontonasal, nasomaxillary, lacrimomaxillary, zygomaticomaxillary, frontomaxillary, zygomaticofrontal, internasal, and the intermaxillary sutures. The Norma Frontalis is read in four parts. They are the frontal, the orbital opening, the piriform aperture, and the lower part of the face. Coming to the frontal portion has got the frontal eminence. It is most prominent in females and children. Behind the frontal eminence, we have the frontal pole of the cerebrum. Below the frontal eminence, we have the superciliary arches. We have medial end of the superciliary arch will give attachment to the muscle corrugator supercilii. The space between the two superciliary arches is called as the glabella. Just below the glabella, we have the nasion, which is the meeting point of the frontonasal and the internasal sutures. Moving on to the orbital opening will have the eyeball and the related structures related to it. The orbital opening has got four margins. They are the superior orbital margin, the lateral orbital margin, the medial and the inferior orbital margin. The superior orbital margin, between the medial 1/3 and the lateral 2/3, we have the superior orbital foramen or a notch. The superior orbital foramen or notch will transmit the superior orbital nerves and vessels. The superior orbital artery is a branch of the internal carotid artery, and the superior orbital nerve is a branch from the ophthalmic division of the trigeminal nerve. The lateral orbital margin is formed by the zygomatic process of the frontal bone and the frontal process of the zygomatic bone. The medial orbital margin is blunt and it's mainly formed by the frontal process of the maxilla. The inferior orbital margin is sharp and it's formed by the maxilla and the zygomatic bone. Moving on to the piriform aperture, it is otherwise called the anterior nasal aperture. The boundaries of the piriform aperture is formed superiorly by the inferior border of the nasal bone and the nasal notch of the maxilla. Below it, we have the anterior nasal spine, which gives origin to the muscle incisivius. Coming on to the lower part of the face, the lower part of the face consists of three bones. We have the zygomatic, maxilla, and the mandible. The zygomatic bone, there are two features. We can see the zygomaticofacial foramen, through which the zygomaticofacial nerves and muscles comes out, and you have the malar prominence, which is the most prominent part in the cheek. Moving to the maxilla we can see the infraorbital foramen, which transmits the infraorbital nerves and vessels. We have the canine eminence, and medial to it we have the incisive fossa, and lateral to it we have the canine fossa. There are three processes of the maxilla can be seen in this view. We have the frontal process of maxilla, which goes to articulate with the frontal bone, the zygomatic process of the maxilla, and the alveolar process of the maxilla, which houses the upper row of teeth. Moving on to the mandible, you can see the upper alveolar border, which houses the lower row of teeth, and the lower border of the mandible, which is called the base of the mandible. Apart from this, we can see the oblique line. The oblique line will give attachment to the buccinator, depressor anguli oris, and depressor labii inferioris. We have seen the mental foramen. The mental foramen mental nerves and vessels passes through it. The meeting point of the lower two mandibles, right and left mandible, is called the symphysis mentae, and the chin we have the mental protuberance. Thank you.